The skeletal system of a newborn baby is said to have more number of skeletal bones than that of a typical adult. Let's know why. I'm Ifeanyi and welcome to my channel. Now, the reason is because the skeletal system of a newborn baby is composed majorly of pliable cartilage, and these bones are not fused together, they're found separately and are counted more. So the common reason is because of what? Fusioning. You can have 3-4 bones fuse when the baby begins to develop to form one hard bone. Now, the skeletal system of a newborn baby is said to have approximately 270 to 300 bones, while that of an adult has 206 bones. Now, let me give you an example. If you look at the head, when you look at the head of a newborn baby, you can see the pulsation. Now, that's because the head of a newborn baby is composed of several flat bone plates that are held together by soft spots called the frontalis. Now, when the baby begins to develop, those bones fuse together, and after you see sutures on the developed cranium. Looking at the clavarium, you can see the mectopic, the coronal, the sagittal suture. By the side, around the temporal region, you see the squamous suture. Behind the occipital region, you see the lambdoid suture. That's the fibrous joints forming a hard cranium, right, coming together of those bones. Let me give you another example. The sacrum. The sacrum comprises of 5 bones, but they are fused together to form one bone. But in a newborn baby, we count them as 5. In the coccyx, that's the human tail, just below or inferior to the sacrum, it's comprised of 4 bones, but it's fused to form one bone. Talking about the pelvis, that's the hip bone. 3 bones, the ilium, ischium, and pubic bone, fused together to form the pelvis. The left and the right pelvis, as each of them has those 3 bones. And then the mandible is said to have around 2 bones, but they fuse together to form one. So these are some of the examples. And let's talk about the 206 bones. Now, the skeletal system is divided into the axial and the appendicular skeleton, where you have 80 axial bones and 126 appendicular bones. Now, on the axial skeleton, which is 80, there are 22 bones on the head, facial 14, and 8 cranial bones. Now, on the cranial, 1 frontal bone, 2 parietal bones, 2 temporal bones, 1 occipital, 1 ethmoid, and 1 sphenoid. The ethmoid is anterior to the sphenoid, that's at the front of the sphenoid. And then for the fascia, there are 2 zygomatic bones, 2 nasal bones, 2 inferior nasal concha, 1 vomer, 1 mandible, 2 maxilla, 2 palatine, and 2 lacrimal bones. Those are the 22 bones of the head. Going down to the vertebral column, irregular bones, there are 26 vertebral bones. That's the spine. And then the ones within the neck region are called the cervical bones. There are 7. C1 to C7. The first one is called the atlas. The second one is called the axis, but there's no viable cartilage between them. But the joint is called the atlantoaxial joint. So the first one is just like a ring supporting the skull. It has no process. The second one has a process called the odontoid process, the C2. And then from the C2, C3, there is fibrocartilage down to C7, having spinous process, transverse process, and spinous process, and also as the foramen. Now going down, there's vertebral foramen and transverse foramen for the rest. But for all of them, there's spinal foramen. So going down within the chest region, right, there's a thoracic vertebra, right? So after the cervical, you have 12 thoracic vertebral spine, right? And then there's a T1 to T12. They articulate with the ribs, right? So below is the abdominal one. We call them the lumbar vertebra. There are 5. So then the coccyx and the sacrum. So the sacrum is 1, the coccyx is 1. So 7 cervical, 12 thoracic, 5 lumbar, 1 sacrum, 1 coccyx, altogether 26. And then thoracic rib cage, 25 bones. So there are 12 pairs of ribs here, 12 pairs of ribs here, joined together by the sternum. They articulate with the sternum at the middle, which is the breastbone. And then the ossicles, the tiny bones, or the most tiny bones in the human body, but the stapes is the most tiny of all. Located in the middle ear, the malleus, uncus, and stapes. They are the smallest bones in the human body, the ossicles. So they form 6. So three pairs, 3 here, 3 here, left and right ears. And then that's altogether 7 to 9. So the remaining one is a hyoid bone. It's a U-shaped bone located in the neck between the mandible and the thyroid cartilage. Altogether forms 80 axial bones. Now, the appendicular bones. 30 upper limb bones. Here. So from here you call it upper limb. That's a hand. This is an upper limb. So the both are upper limbs. Each comprises of 30 bones. So altogether there are 60 upper limb bones. Now let's name them. The humerus, the bone here. Right? Then the radius and ulna. There are 2 long slim bones here in the forearm. The radius, the radius and the ulna. And then for the joints, the wrist is called the carpal bone joint. And these are the scaphoid, lunate, trichitrum, pisiform, trapezium, trapezoid, capitate, and hamate. They form the gliding joint. 4 superior, 4 inferior. Those way are named as the first 4, the second 4. They form the gliding joint of the wrist. And then the metacarpal bones. Each of the finger has bones before the main phalanges. These are the metacarpal bones. And then the phalangeal bones. From here, 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 here. And when you look at it, you can see each of the finger has 3 phalangeal bones, and except for the pollex that has 2, it has a proximal and it has a distal. But the remaining, they have proximal, middle, and distal. Right? So these are the 14 phalangeal bones. So you have 14 phalangeal bones, 5 metacarpal bones, 8 carpal bones, 1 radius, 1 ulna, and the humerus. All together 30 for the 2 arms. Let's go down to the lower limb. So we've got to 60. Go down to the lower limb. Those are the leg. We'll start with the longest bone in the human body, which is the femur. After the femur, you have the kneecap. It's called the patella, the largest sesamoid bone. And then we have the tibia and fibula, the shin bone, tibia. And then the back one is called the fibula. Then on the ankle, since we call this one the carpal bone, that's the wrist, we call that one the tarsal bones. So on the ankle, there are 7 bones there. You have the talus, calcaneus, navicular, cuboid, and the 3 cuneiform bones, medial, intermediate, and lateral. And then just where you have the metacarpal bones, they are the metatarsal bones there for the phalangeal bones. And the same with the 14 phalangeal bones, the same way you have 14 phalangeal bones. So altogether is 60 for both legs. And then up the upper limb, 60. So 60 upper limb, 60 lower limb bones. 120. The remaining 6 comes from the girdles. The pelvic girdle, which is a hip bone. There are 2 pelvic girdles, left and right. Each of them comprised of 3 bones, ilium, ischium, and pubic bone. Those are the 2 pelvis, right? Making it 122. So the remaining 4 are from the pectoral girdle, the 2 clavicular bone, and the 2 scapular bone. Right? These are the 126 bones. If you find this video educative, please like, share, and subscribe, and I'll see you in the next video.